Hey, today I'm going to share with you a way to deal with wrist injury or chronic wrist pain. Let's go. Okay, so if you are recovering from an injury, there's going to be always 3 steps you have to go through in order to heal, in my opinion. First one is accepting the pain. If you are in an acute injury, just happened less than 3 weeks ago, or you had surgery or something like that, back off, take care of yourself. I said, make sure you are taking care enough. If this has been more than 3 or 6 weeks and you're moving into chronic pain, you've probably not accepted that you are in this pain. And that's where we're going to meet. You need, in order to heal, to understand that this is happening right now and that you can't fight it with pushing through. Okay? Second of all, hiding from it is not going to help either. The second step is learn how to work around it without pushing. So whenever we are in pain in a certain part of the body, it doesn't mean, even all over the body, it doesn't mean we're all handicapped. It's important to understand that. So just, work with what you have and learn how to not put pressure into that part of your body. Not pushing, but not finding an excuse in it either. And that is going to be in relate to practice. We're going to have like the practice, and the post taking care. We're going to talk about that. The last one, the last step is the probably least popular, patience. It'll take time to heal. And sometimes that is way more than you would like it to be. And sometimes it's shorter and it goes quicker than you thought. But, my wrist injury took like 3.5 years. You need to stay humble, keep the patience with yourself, with the pain, and just work on the things that help you until finally that moment comes and it's relieving. And it's just, I can help you, guide you through what helped me, but eventually it will also be a mental process, not just a physical, right? It's anyway the same. Okay, so in regard to your practice, it is really important to warm up the wrists before practice if you have a problem. I think there's enough content about this on the internet. For me, the stretches that I do after my practice are as much a warm-up as well, so I can stretch the same way before and feel like that's going to help my practice. Generally, there are a few things you can do, like this, or grabbing, or wrist rolling, and pulling the heels of the hands off the floor, stuff like that. You're going to find a lot on it. I like a few stretches the most that I'm going to show you for after the practice, and you can use them as well for before. But more importantly, I think, than pre-stretching and post-stretching is that you actually learn how to use your hands and wrists in the practice accordingly, appropriately. It's like when you learn a new language, if you're not going to speak the language, it's not going to be easy to learn it. There's just no way. It's going to take forever, right? So if you learn to use that language of how to use the wrist correctly during your practice, this is the best warm-up that you can have, okay? In terms of your wrists or any other joint in the body, it's really like any joint in the body and any nerve in the body does not like to be compressed. There are certain compressions that are fine or twists that are fine, but never without extension. So just compressing will never be okay for any part of any joint. And that's the same for the wrists, right? So if you want to not push into your wrists, you need to activate the muscles. You don't actually have a lot of muscles here. It's mostly tendons, but the muscles are here in the forearm. So you need to like learn to grab the floor, pull the middle knuckle up and push the other knuckles down. That means the ones from the palm and the ones from the top of the finger. And just lift the middle one because that's going to make your palm push down and grab the floor. And you will feel it on the flexor side of the arm, the forearm, and on the extension side, right? So you're going to grab the floor with every posture you do with your hands. That is not important whether that is a down dog position or a coming forward into plank, or if that's anything else, a crow. Anything you do, you should be learning to really grab the floor. This is the first thing you have to do. If you want to heal from this injury, you need to give the wrist the possibility to actually create some space through your muscle activation instead of pushing into it, right? Because if I just like push into it by planking this way, it'll compress. Good? Okay, so second of all, there are some stretches that I like, that are really helpful for me, and I want to share them with you. So this one, fists together and trying to keep the thumb together and then lowering your elbows and lifting up. This is one that I really like to do. You can make it dynamic like this, or you can try and like just stay and straighten your arms. For me, this is really hard. So the key is to keep the fingers curled, not to open the fingers, the fists. It's quite intense for me. So if you have a wrist injury, you're probably going to feel it. If you just do a lot on your hands, you're probably going to feel it too, right? Okay, so that's one thing. And I really like to stand on my hands. It's like a little massage. So just feet, like Padastasana, feet on your hands and just like really grab with your toes into your hands and basically give the arms the possibility to decompress the wrist by just doing the posture as usual, putting the elbows out and pushing the toes down. You're decompressing the wrist. Then another way is to do this the other way around, so just bringing the palms down, and that's really nice as well. It's a beautiful decompression as well. So you're grabbing your toes into the wrist and just try and bend your elbows. Also a nice stretch here in the forearm on the flexor side. And just breathe into it. Good. And then one of my favorite stretches ever is to bring your both forearms onto the floor and just like kind of walk onto it or onto them. So your both shins should be on the forearm. And you can put one knee in the hand, but so I have my right arm on the lower side. So the right shin is pushing into my right belly of the forearm muscle. And after some time, I'm going to switch them up. You can do this like a few minutes. Bring the head down to the floor if you need that exchange of leverage for a moment. Just like really wiggle that shin. It sometimes feels like a knife into the into the forearm, but you know, it really helps. It's a great stretch. You're gonna like it. It's the best self massage in terms of forearm and the wrist, I know. And then there's one more thing. So as I mentioned, the muscles that are kind of moving all this are in this part of the forearm, right? So if you have a tennis ball, you can do the same with the hands, just massaging on both sides. But if you want to push a little bit into the myofascial release, you can like push the tennis ball in there and then like just find the spot where it really hurts and breathe, right? And just push. It's not easy in the beginning. It makes you squirm, but eventually it will be feeling much better after. Okay, so this is a very good one too. You can do it in the evening, just before going to bed, for example, or after practice. It'll help to keep the inflammation down, keep some blood flow, make it heal. And then, as I said, the last one is patience. Give yourself the time. Nothing more to be said. I wish you a good recovery. Thank you.